So what's something that not enough people are talking about in healthcare?
I think if you listen to the theme here, it's going to emerge as artificial intelligence. This is going to be the macro theme, I think, for this conference. And I think the thing people aren't talking about is, could this be the technology? Could this be the rare instance where healthcare leads on adoption of a technology compared to the other industries? So that's something that we're really excited about. We think there's a lot of opportunity to do that. There's a lot of questions, there's a lot of concerns, but it might be one of those rare things where healthcare can lead on the technology.
What's something not enough people are talking about in healthcare?
Well, the HIM show is doing a great job when it comes to remote patient monitoring, telehealth, and other technologies that relate to a medical population, but they're really not doing enough when it comes to the biggest health crisis that we have out there today, which is overdose deaths from fentanyl. So I really wish that HIMSS would be a lot more focused on that, because fentanyl is 50 times more potent than heroin, 100 times more potent than morphine, and 300 people a day are dying from it. So we really need to pay attention to that.
I think with the end of the COVID-19 pandemic, people are not talking enough about the learnings that we had in the pandemic around the need for visibility across our healthcare operations and the infrastructure of U.S. healthcare. Throughout the COVID-19 pandemic, TeleTracking was contracted by the Department of Health and Human Services to provide visibility in real time to the capacity and utilization of our assets, beds, PPE, et cetera, ultimately therapeutics and vaccines. As the pandemic comes to an end in May 11th, what you're seeing is the belief is the need for that visibility is fading away as well. We believe there's a need for an all hazards platform that is in preparation for the next pandemic, which is not 100 years from now. It's in the next 10. It's the need for hurricane season that is coming, and that we need to be prepared for it. The need for the risk of bioterrorism in municipal areas and the ability to understand what is happening in our healthcare infrastructure. I think that is not being talked about enough.
I think there's a lot of chatter around AI and ChatGPT, and I think, most people are honestly quite tired of hearing about ChatGPT. So I think if I were to say there's one thing that not enough people are talking about is the human experience and how AI and ChatGPT is going to impact the human experience within healthcare. And what I mean by that is the patient has to be at the center of the human experience. And how is all of this technology going to impact that patient experience? I think that's something that not enough people are thinking about and not enough people are talking about.
What's something that people aren't doing enough in the healthcare and health IT space?
Sure, thank you. Yeah, I think two things: that it's a lot of talking without a lot of doing. So how can you get a lot of this great technology that we're seeing and that's all around the place in the hands of the patients to help start improving a lot of healthcare and get them to be able to take advantage of it? So I think a couple of things that help that is, hey, how do you get this and put it in a place where people can use it within their everyday lifestyle? And then also on the provider side, how can you do this that this fits into their workflow? So if you're not taking those two things into consideration, it's not going to get used and not have the effects that you think it's going to have.
So tell me, what's something not enough people are talking about in healthcare right now?
One of the biggest trends we're starting to see now is a shift to committed capital and innovation towards a younger patient population in healthcare. We as a fund focus on pediatric healthcare, which is innovation targeting the unmet medical needs of patients from neonatology all the way through to young adults, individuals under the age of 21. And unfortunately, it's been an unmet medical need for over 25 years. And we're now thankfully seeing a real trend in greater commitment, both from an innovation as well as from a regulatory standpoint, to advancing innovation, helping that patient population.
So I think you walk around the hall today, everyone's talking about interoperability. I think what they're not talking about is interoperability doesn't mean any one thing. Interoperability is really just a philosophy. And so it's this philosophy that data should be available. But until you start thinking about the actual underlying use case, the constituents, what they're trying to solve for, you can't make the data usable. You can't actually start to unlock value. And so what I'd love to hear people talking more about is what are they actually doing on top of all this data interoperability? What problem are they actually solving? Who are they solving it for? And why should any of us really take notice. We've been talking about interoperability as a concept for decades. And, I want to hear about what people are doing to solve real problems.
Tell me, what is something not enough people are talking about in healthcare?
It's interesting with all this talks about TEFCA and the QHINs. There hasn't been a lot of talk about the sustainable business model around TEFCA and the QHINs. And I think that's still an open question that needs to be understood and settled.
That's a great question. I think a lot of people are talking about technology as a big solution and as a requirement for getting through some of these crises that we're facing. But I think what we're struggling with is really making sure that the technology actually meets the needs of the staff themselves, and that we're not just providing a great technology, but we're actually providing a great solution as well, and one that can be kind of translated between the different clinical environments that we're seeing.
I don't think people are talking enough about how to scale data collaboration. We hear a lot about interoperability, which is hugely important when it comes to having, connecting data to get patient-centric outcomes, but not enough about, okay, how do you do that connectivity at scale? And this is the challenge that Karlsgate was developed to solve, right? We built our tools in order to create the capability to connect easily, but also safely and at scale. And we do this by creating a technology that is based on a zero trust architecture and allows you to integrate into all data operations by embedding into all data workflows easily, so it's not a separate platform. And then we have automated all of the hard parts about data connectivity, whether that's transformation, normalization, standardization. How do you connect and match data and give you flexibility to do that? De-identification, all of those things are fully automated within our solution, which is easy to set up and easy to get up and running. And therefore, our main focus is really about making data connectivity safe, easy, and scalable.
We're at a technology conference, right? But I think one of the things that is not being talked about enough is really the role of hybrid care. We can't forget that a lot of care is delivered in person, but virtual is playing such an important component right now. But it's a journey that patients and their families and providers are on. And I think more and more people need to understand and kind of talk in that language of it's a hybrid environment. So we got to be thinking about what works both, in person, but also what works virtually, but all the other steps in between. How can we connect better with patients and their families so that it's really something that throughout the journey of healthcare, we're all very focused on and driving the right outcomes.
What's something not enough people are talking about in healthcare?
Sure. It's interesting at this conference, if you look at who we're meeting with and the attendees, we've got a tremendous amount of technology. And I think if we don't focus on the outcomes that are generated for our patients through the use of technology, we're kind of missing the point. And I think not enough people are looking at how to use technology early in an acute encounter to change that outcome overall positively for our patients.
What's something not enough people are talking about in healthcare right now?
Yeah, so I think one of the most inflammatory statistics that we had was potentially the statistic that we looked at respondents, and about 55% of our respondents told us that they would be willing to switch their providers based on whether or not their communication needs were being met. And then 41% of our respondents said that they would be willing to walk to a different provider if that provider does not offer text messaging. So pretty impactful.
Okay, so what is something that you think not enough people are talking about in healthcare that they should be?
So we're all walking around HIMSS. Our dogs are all barking, right? I walk 30 miles, almost every HIMSS, maybe more. All these applications, these EMRs, these shiny new objects, Internet of Medical Things, medical devices, all these great devices need one thing. They need a great network. And we look at the network as, it's utility in some cases, but really, if you don't have a good network, you don't have good bandwidth, then you don't have a good service for those clinicians to support patient care, all those fun things. So I think that's something that's fairly underserved, is talking about how important the network is to facilitate all these great things here at the show.
Well, I don't know if it's not enough people talking about it. It's really remembering. I think we're at a case where what is, was old is new again. And especially talking about the basics. It's penetration testing, knowing what's going on in your environment, but it's different now. It's no longer really can you do that one and done throughout the year or even periodic, because things are changing so rapidly in healthcare. It's almost that continuous pen testing idea. So you want to go through and constantly looking at your environment, new attack surfaces, and new vulnerabilities.
Well, I think one of the things that hasn't been discussed a lot during the HIMSS conference is really around this clinician burnout piece and staff turnover. So lots of nurses, lots of clinicians really feeling it at the front lines of care. Coming out of COVID, obviously this was a problem before COVID, but it's really accelerated outside of COVID. So we're really happy at Connexall where we can help with that burnout and fatigue and make clinicians focus on their patient care and the patient experience, which is what matters most.
And Jonathan, what is something that people aren't talking about enough in healthcare?
I think it's data. As weird as that sounds, it's like the truck backed up and just dumped it all in our laps. So what are we doing with that data and like sorting it, making sure it's getting to the right person at the right time in the right place to deliver better care and payment outcomes? I think right now it's a lot of noise and there's a lot of talk about privacy and interoperability, but we could really use that data to make things better.
What is something that not enough people are talking about here at HIMSS?
Yeah, so really imaging. But I think if you zoom out, there's a lot of focus on interoperability, and within that interoperability conversation, a lot of folks are talking about interoperability between providers, but they're really not talking about interoperability with the patient, arguably the most important stakeholder in healthcare. And what we're really focused on at PocketHealth is making healthcare more interoperable for patients.
Awesome. Well, thanks so much. And thanks everyone for watching.
Thank
If you want to find more great healthcare IT content, check it out at healthcareittoday.com.